Welcome, everyone. My name is Leah Romano. We're so excited that you're joining our Aquifer 101 webinar, Intro to Aquifer Cases and Tools for Clinical Learning. So today's presenters and panelists will be sharing their wealth of information. We have Dr. Sherilyn Smith, our Professor of Pediatrics and retired University of Washington School of Medicine, Cynthia Lord, Aquifer Teaching and Learning Lead for our PA Education Group and Associate Professor, Center for Medical Education at Case Western Reserve University School of Medicine. And joining me on the panel for Q&A is my colleague, Kate Hancock, one of our other relationship managers here at Aquifer. We're excited to share with you. Today, questions to answer, what we'll cover. We're going to cover what is Aquifer, how can Aquifer help my students and faculty, what learning tools and features are available with Aquifer, and what's in an Aquifer case. We're going to explore some more for you. There's also a Q&A panel on your screen where you can also share any questions you have. We'll be monitoring both, and there's a moderated Q&A session at the end. So we're going to get started. Hope you enjoy.
Hello, my name is Cindy Lord. I'm a primary care PA, associate professor at Case Western Reserve University, and chair of the Aquifer PA Educator Task Force, and a member of the teaching and learning team. So now let's dive in and see what Aquifer delivers. Aquifer's virtual patient cases are developed by expert faculty to help develop clinical reasoning and decision-making skills. Aquifer cases provide rich, detailed case scenarios that mirror real clinical scenarios. Cases model communication with patients and preceptors, ask key questions along the way, and include real diagnostic test results. Aquifer is a unique, nonprofit organization dedicated to advancing health professions education. Aquifer has a big impact on medical and health professions education. Currently, 96% of U.S. allopathic medical schools, 70% of osteopathic medical schools, over 90 physician assistant programs, and a growing number of international medical schools and nurse practitioner programs rely on Aquifer's trusted content to support their clinical learners. 1.3 million Aquifer cases were used last year, and we have a growing network of academic contributors. Aquifer was created by educators for educators. All Aquifer content is developed and maintained by interdisciplinary teams of educators working to ensure our cases and learning tools are accurate and up to date. And our network is growing. More educators are joining this collaborative team, including in the areas of PA and NP education. Our course content is developed in collaboration with national educator associations. Aquifer cases cover the National Medical Student Clerkship curriculum for each discipline, which ensures availability to you and your students for broad, comprehensive coverage of key conditions and patients. This also aligns quite well with PA curriculum. Let's take a look at Aquifer and how it can help. Aquifer case scenarios include diagnosis and management decision points to get your students thinking like a clinician. They are ideal for preparing for clinic or to review and practice clinical and communication skills. It's a safe space for students to learn and practice before having to be in a patient room with a preceptor, a sick patient, or a nervous loved one. It's perfect for building confidence or for remediating clinical skills. Aquifer cases are designed to fill gaps and ensure students are exposed to key conditions, covering cases that they may miss in clinic due to lack of patients, seasonality, or geography. Aquifer cases take the time to go through all the steps of a complete patient encounter, from the history and physical exam through building a differential diagnosis and into treatment and management plans. Cases are in-depth, covering what is not always possible in person. Some cases also include a follow-up visit, providing a long-range view of patient care. Let's take a look at the teaching and learning tools, including what courses Aquifer offers, as well as their assessment options. Aquifer offers a full library of subscription-based courses in a range of disciplines. Case collections range from 10 to 40 cases, covering a wide range of bread and butter cases your students need to see in order to be successful practitioners. We're excited to announce the debut of our newest Aquifer signature course, Aquifer Neurology, coming July 1, 2023. Aquifer also offers a series of interdisciplinary courses. These topics and skills are so important and often hidden in the curriculum. These cases help bring them to life without requiring faculty time. Integrated illness scripts are another Aquifer tool specifically designed to integrate basic and clinical science. A set of 33 scripts for key conditions is available to curricular partners or for individual subscription. Scripts cover the epidemiology and clinical features with basic science and mechanisms embedded for each condition. Plus, there's a mechanism of disease map. Aquifer partners with NYU and the Hazelton Betty Ford Foundation to deliver courses on addiction, surgery, and readiness for practice modules. Aquifer also offers assessment tools. A clinical decision-making exam is available for internal medicine and is included with an internal medicine course subscription. Additionally, Aquifer is piloting a new formative assessment system called Calibrate. This is currently in development for family medicine, internal medicine, pediatrics, and radiology, and is being tested by some of our curricular partner programs in allopathic and osteopathic schools, as well as nurse practitioner and PA programs. This innovative new assessment tool derives self-directed learning, identifies true knowledge gaps by calibrating knowledge and certainty, and uncovers curricular gaps for faculty. Calibrate will be broadly available starting in July 2023. Aquifer's learning tools are really well supported. To help you get started, Aquifer provides a complete educator guide for each course. Many disciplines also include access to ready-to-use active learning activities for your classroom to accompany Aquifer cases to save faculty time. The Educator-to-Educator resource directory brings you an extensive library of strategies and tips from your peers by way of webinars, blogs, and podcasts to help you make the most of your Aquifer access without reinventing the wheel. It's a great way to learn from the experiences of other educators. Aquifer has many features to help support educators and administrators in using its many educational tools. There's a searchable content library where you can sort and filter Aquifer cases and scripts to find exactly what you need, and then create a custom course to assign to a group of students. The platform includes features for tracking student progress and managing users. Aquifer also has really deep resources to help you get up to speed. Whether you're learning a platform or looking for teaching strategies, there's a team of expert staff and educators to help you with questions and support. Aquifer offers a curricular partner program. This option gives you access to the full library of Aquifer cases, exclusive access to the new tools and assessments, such as Aquifer Calibrate Formative Assessment Pilot, peer consultation with a curriculum integration expert, and fully developed activities to save you time. And now, to see the cases and features live, I'll turn it over to Sherilyn Smith.
So, hey, I'm Sherilyn Smith, the Aquifer Chief Academic Officer, and I'm going to show you around our Aquifer learning tools. But before I do that, I want to make sure you all really focus in a few things that you can think about as I show you the details. So the things that I want you to know about the Aquifer cases are, first, they are really deep and thorough. They cover a broad array of topics, and the students are actually able to go deep and learn in depth about communication or whatever the teaching is. And this has really important effect because it may take up to 45 minutes for the students to complete the cases. So make sure you plan around that as you're thinking about how to use these cases in your courses. They're evidence-based and peer reviews. We have a lot of great educators who review them all the time and make sure that we're up to date with the latest guidelines. And these are written from a student perspective. So really the student is the center of the story along with the patient, and lots of modeling about how to ask questions. So students really can learn how they're supposed to show up as they take care of patients when they're working through our cases. So now let's go into Aqueduct, our teaching and learning platform, and I'm going to show you how our cases work, explain about our pedagogy more in depth, and explore more of the features and reports that can help you use these with your students. Whether you decide to subscribe to Aquifer courses or you want to start by exploring our free cases, you'll need to sign into our platform, and we're here to help you. And so once you've signed in, you will end up where what we call the landing page. And this has all of the different types of resources that we're going to go through that you have access to, as well as all the cases. So what I'd like to start with is a little bit of a tour of a case so you can know what to look for, what your students are experiencing, and bring to life some of the things that I talked about in the introduction. So here we're in family medicine. And one of the things that's a little bit different here that you'll see is that you have a different view of the cases than the students do. So just keep that in mind, and I'll highlight some of the differences as we go along. So I'm going to click on family medicine case number 5, one of my favorites. And one of the things that you all need to remember is that these cases are very rich. So they take somewhere between 30 and 45 minutes for a student to complete. And so I would plan about 45 minutes in your curriculum. Some of our cases are a little bit shorter, 20 to 30 minutes, but plan on that 45 minutes. That's perfect for students. The other thing is that the student experience is going to be different than what you see right here. So there is a progressive disclosure. So what you're seeing right now is the faculty view, where you can see all of the elements that the student will work through. They're going to see one page at a time. So they'll just see the introduction. And then once they work through the content, then they'll be able to see the history, the past medical history review, et cetera, et cetera. So just keep that in mind as you are thinking about how the students will use the cases. So you can see that, as I mentioned in the introduction, we really work through all of the elements of the history and physical. So you can see history. I'll come back to the summary statements and differential diagnosis, the physical exam, really thinking about treatment and what care plans might emerge, as well as follow-up visits. So it's this comprehensive case that is really great for the students to see. Some of the other things that are really important for you to know, and it starts right away, they're embedded questions throughout the entire case. And so for this is the introduction, we ask about, what can cause palpitations? And so the students have an opportunity to write their answers. Now, you won't be able to see the answers to these questions because this is a safe learning space for them. But they get great teaching right afterwards. So they submit their answers and then they get an expert comment right away. So there are going to be embedded questions throughout the entire case on all different aspects. We also do a lot of modeling about communication. And so you can see here that this is a question and answer, really helping students understand what are best practices for communication, how to gather data, and then how to remain in a patient-centered manner. So that is also sprinkled throughout all of the cases. One of the things that I really like, and again, linking back to that focus on developing clinical reasoning skills, are these two elements, the summary statement and the differential diagnosis. So a summary statement, we ask the students to think back, what do they know about the case so far, synthesize it and put it in a really concise statement. So they write it here. We give them guidelines for what a good summary statement is. And then we model for them what a summary statement should look like, and then point out the key features that they should be paying attention to. You can see along this side over here on your right that students can keep track of things as they go along. And so that's a nice thing to point out to them in the orientation. This summary statement you can actually see in the case reports, and I'm going to show that to you a little bit later. So continuing on the clinical reasoning theme, we ask them to make a differential diagnosis. And so they have to choose the ones that make sense. They get feedback, and then they get amazing teaching about, say, the differential diagnosis of palpitations in this case. Students can bookmark this content if they like and keep track, so that they will have their own unique note-taking system throughout the cases. So it's a really great way for them to reinforce their learning. All right, so one of the other things that I'd like to show you is some of our embedded imaging. So in this case, we're talking about the preceptor and the student are talking about the test results and how do you interpret them, nice question and answer. And then you can see that in our teaching point, you see some really great examples of radiology about thyroid scans. So we try to embed important test results, imaging, things like EKGs, so the students can have some practice interpreting as well as seeing some real images and examples of what tests might also look like. One of the last things, so I've done this, nice overview of what's in the case. And as the students work through, you can see that they get down to the case summary. Now, this is something the students really, really love. So they click Finish Case, and then they can download the case summary. And what the case summary has in it, as this loads up so I can show you, is a synopsis of all the great teaching points in the case. So you could see, remember we talked a little bit about the palpitations, characterization, and etiology. That is right here. So the students have this to study from, to review from. They can take it with them. It's totally awesome. The students actually ask us to do that. And this is something that's also available for you through the educator resources. So you don't have to click through and do all of cases. You can actually get this case summary so you know exactly what the student is doing. And another thing that the students ask for and really also love are the self-assessment questions. So every case has self-assessment questions. Make sure that the students know this. This is after they download the case summary, so they may get all excited and they're like, stop. But there are five self-assessment questions for all of our cases that really enforce the learning in the case. So this is an example of the types of self-assessment questions that we have. You can see that it's, again, somebody, in this case, it's linked back to the case, so palpitations, but it's a little bit different. And so really going back to those critical things that the student must know, they have to choose, and then they get the answer comment really very clear about what is important and feedback on their learning. So first of all, one of the things that I'm super excited about is something new that we're offering to our curricular partners, the integrated illness scripts. And so the integrated illness scripts really are focused on helping students leverage basic science knowledge to make better clinical decisions. That's what we're all about, again, that clinical reasoning skill. And so you can see that we have a large number of them. They're on key topics. And what I'd like to do is show you what sort of the anatomy of an integrated illness script is. And so when we open up asthma, you can see these are the elements. And the first is sort of an overview of what is asthma, and then what's the pathophysiologic insult? What went wrong that somebody actually has asthma? And then one of the really cool things is that the students are presented with key symptoms. And this really allows them to think through, like, why does somebody cough if they have asthma? And so they're allowed to really leverage that basic science knowledge. It allows them to pull all of that in, and then it'll allow them to compare and contrast, like maybe somebody's coughing, the cough is different if they have chronic lung disease, for instance. This is all linked to the national curriculum from our basic science educators, IAMC. I would also like to show you the mechanism of disease map. And so here, this is a part of all of the integrated illness scripts. It allows students to think forward and backwards, the way that I think about two different ways of thinking, understanding, say, asthma in this case. From the symptoms, why does somebody have the particular symptoms? That's a wonderful way to tee up why in basic science information is important for students in the preclinical. And then if they know about asthma, then think through all the pathophysiology. So mechanisms of disease maps are a part of all the integrated illness scripts. So just really wonderful. Now, what I like to do now is show you, hopefully you're not getting overwhelmed with all of the content we have. And here's a tool to help you sort through and make sure that you have everything that you want at your fingertips, and it's our content library. So our content library allows you to filter all of our content based on these different criteria, whether it's presenting problems, say palpitation that I showed before, the final diagnosis, hyperthyroidism, for example, or other diagnoses that show up in the case. You can filter by specific courses. So you should say you want to see all of the Aquifer internal medicine cases, you can do that. If you want to do basic science disciplines, molecular biology, it's all right there. Clinical disciplines that go across courses, say women's health, you can look at it that way. Or if you really want to see all of the outpatients possibilities, you can do by clinical location. So that's a fast way for you to find different cases. And then if you are trying to figure out, is this case actually one of the ones that I would like to do, then one of the things, the way that you can do this is go down and look at the synopsis. And it gives you a little synopsis of the case. It talks about the differential diagnosis, and then you can make an informed decision. So to bring this to life and give you an example, let me do a little bit of selection so I can create a custom course. So I'm really interested, so I'm a pediatrician, we're gonna go pediatrics. And then I am really interested in, let's see, gastrointestinal problems, because I'm getting ready for my students to be out in clinic, and it's the winter and it's time for everybody to have diarrhea. So I want to make sure that they can just focus in on these different cases. And so if you want, I want to create a custom course. And so what you just do, so you can add one, or you can add 5 shown, great. And then hit create course. And then we go. And there's my custom course. And so I'll show you what this really looks like after you've identified more in another example as I'm going through reporting. So what I'd like to do now is to show you some of the other resources that you have to help you integrate Aquifer into your course. So I'm going to click on Educator Resources. And you can see that we have educator resources for all of our courses. And so to give you a taste about what's in our educator resources, I'm going to click on pediatrics. And something that is there for every single course, which is super helpful, is an educator guide. So we do have a quick guide that just lists the case, the differential diagnosis, and the final diagnosis. The educator guide gives a more comprehensive overview. And so this is something that you can share with your preceptors. You can download this for quick reference. You have a table of contents. One of the things that I really like is the case overview. So if you just click on a case, it'll give you the case synopsis, the learning objectives, again, the differential diagnosis and the final diagnosis. And if there are associated learning activities, you could click right there. If they're available, and many of our courses do have additional teaching approaches that are just perfect and ready for you to use off the shelf. So an example is the pediatric active learning modules. So here are the 4 topics, and each one of these has a facilitator's guide, answer questions for the students, handouts that you need to give them. Everything is ready for you just to take, to read, and then implement with your faculty and your students. So all of these things are available in our educator resources, and they really do help you integrate Aquifer into your curriculum. There are student resources that students can leverage within the cases and in their clinical setting. So these are listed right here. Again, something that you can find on your landing page. So what I'd like to do now, you all, is pull this together, bring it all to life, and show you some really important things about reporting and finding out what your students are doing. And I know that you've probably been wondering about that as I've been talking about all of the things that you can do with Aquifer. So what I'm going to do now is go down to here, this internal medicine rotation block 3. And this is a custom course. So you're going to be able to see a custom course in action. So clicking in here, you can see that we have combined, appendicitis, so some illness scripts here, some high value care, and then some internal medicine cases. And if you're really wondering about how is my student doing with this, you go up to the right and there's the course report button. So I'm going to click on that. And what you can see here is a real nice snapshot of everybody in your course and how they're doing. And so those lovely green checks means the students have completed everything that you've asked them to do. The yellows are in progress, and the reds are they haven't gotten started yet. You can do this both. So going up to the top, you can see this for the cases as well as for the illness scripts. So what I'd like to do now is go down to the student here, Felix Hernandez, and show you what it looks like at the student level. So you can see that Felix hasn't started the high value care, but he's doing a great job with his internal medicine cases. And so nice green check. And remember I mentioned that summary statement? Well, here is his work. And so you can actually see what he wrote. And then right next to it is the expert comment for that. So it's really great to be able to compare and contrast. This is something that you can actually track, follow the students through, and see how they're doing. So I know I've covered a lot, and if there are things that you don't remember or you get started and you're just like, what? There's this wonderful need help button that appears in Aqueduct. So you'll be able to find it, and it's going to pop up in your reporting or in the cases wherever you are navigating. And so if you have questions about getting started or how do I make a custom course, please realize that we have a lot of material here to really get you started going forward. And if you really get stuck, we're here to help you. Just reach out to our support and we'll make sure that you have the best experience you can from Aquifer. And so what I'd like to do now is we're going to go back and talk about some best practices for integrating Aquifer into your courses. So we have gained and learned so much from you all throughout the last many years about some of the best practices and strategies for using Aquifer in different courses. We started and continue to think about Aquifer as a really important tool to supplement clinical experiences. Now, you can assign them as key cases during your rotations. Those don't miss diagnoses. You can have students, or you can select for students cases that might fill some gaps. And so you know, based on the time of year, your clinical setting, that perhaps students will not be able to see key diagnoses. And then you can also link all of these to didactics, case discussion, group activities, really to have an equal learning platform and starting place for everybody to engage in great discussion during your course. You can also use these to help students prepare for clinic. And this can start before they ever get to the clinic. So in your preclinical courses, to provide them that very valuable clinical context. Use as part of a clinical year orientation to highlight important aspects that may be unique to a particular setting. Prep for rotations or key cases in the rotations. I assign the pediatric well child care cases to students at the very beginning of their outpatient rotation, so they have an idea about like what the heck is a well child visit. And specific cases or patients, you can target those particular things. I have curated them, and for inpatient rotations having to do with pulmonary patients, you can assign those cases. And then flipping it around, these can be part of a boot camp at the end of training to help them revisit important topics. I think of Aquifer as standardized patients. You can use this as a platform to jump off for clinical skills training as outlined here. Writing SOAP notes, we've talked to people using these as part of a telehealth curriculum, so many different opportunities. I also use these for remediation. So these are customizable. So depending on what what you need to work on with your student, I think that figuring out which cases are important, whether it's a knowledge deficit, a clinical reasoning deficit, you just want to do a little diagnostic, you can use that custom course function that I talked to you about, and then have them work through the cases and then debrief them. You can use Aquifer exams in your curriculum as well, the multiple choice exams from family medicine, pediatrics, or radiology. We have a really very neat clinical decision-making exam that's for Aquifer internal medicine, so focused on adult patients. We have a formative assessment strategy that's in development that will allow progress testing. And as I said, that you can review the summary statements and build your own sort of deliverables around your cases. Using integrated illness scripts, I've alluded to some of these before, and you can integrate them in case-based learning. They can be study guides, and they provide some clinical context to the basic science courses. And so as you can see, Aquifer's learning tools are vast, virtual, flexible. You really can find a resource that's going to fit whatever you need to do for your learning and all of your students. So, and now I'm going to turn it over to our wonderful relationship manager, Leah Romano, to tell you about the next steps to learn more about Aquifer and how that might be useful for you.
Thank you, Sherilyn. My name is Leah Romano, and I'm a relationship manager here at Aquifer. To learn more and explore, you can visit our website, www.aquifer.org. If you click on the subscribe button, you can demo a case, access free cases, request a quote, and learn more about our subscriptions. To explore more, you can click on resources and view our course content and teaching strategies, as well as other tools such as webinars, blogs, and podcasts. We're here to help. Now on to our Q&A.
Hello, everyone. So we hope the presentation was really helpful. Joining me on the Q&A is Kate Hancock, our other relationship manager here. So please feel free to enter questions in either the Q&A section or the chat section. We don't see any yet, but I will moderate them. So while we're doing that, we can have Kate share some, top resources for folks considering looking at Aquifer, and we may need to share the screen, so take down the Q&A slide in order to do that. Kate, is that something that you can share while people are filling in questions?
I would be delighted to, Leah.
Great.
Hi, everyone. I'm so glad you're here. It is always a little difficult to follow Cindy Lord, who is phenomenal, and Dr. Sherilyn Smith, who is equally wonderful. They have provided a truly outstanding overview of Aquifer and the Aqueduct platform. And one thing I've done here is signed in as what we call a curriculum administrator. And I just want to emphasize something that Dr. Smith demonstrated, but I really feel like is kind of the obvious, but hidden
Gem.
Really treasure trove of Aquifer. There's probably a better word out there, but it is our content library. Aquifer as a whole is really, as was indicated by our speakers, by and for educators for the benefit of healthcare students. And it brings together all the best and brightest tools and resources in this virtual environment. And it really can be whatever you want it to be. So you might be a nurse practitioner and you have a very strong but small group of students who really want to become experts in geriatrics. And you can subscribe to Aquifer and take advantage of our Aquifer Geriatrics course, which is outstanding. But you also might come from a large osteopathic medical school or allopathic medical school and have a lot of needs across many different kinds of clerkships. And in the content library, all of that comes together. And it really can be a place where you go and you find exactly what you want. If you work in pediatrics, you might, as Dr. Smith indicated, spend a lot of time in in Aquifer pediatrics. However, you might be teaching with a basic scientist, you might be exploring interdisciplinary offerings, and you might want to go to our high value care and see what kind of content there is that could be combined, for instance, with our integrated illness scripts and help with students for the transition from the basic sciences to the clinical year. And I really want to emphasize to anyone who is looking at Aquifer to understand that the content library is the best place, in my opinion, humble opinion, to start at seeing what Aquifer can offer you and your program. And that's why I wanted to bring you here again, and also emphasize on the right-hand side where Dr. Smith went, which is the system sort. And this is incredibly powerful. What we learned in March of 2020 was that a lot of our programs who subscribed at that time, when things shut down at so many programs across the United States, they went straight here and went to respiratory and found every single case and said, yes, you might not be in clinic anymore, you might not be in the classroom anymore, but I want you to sign into Aqueduct and do all the respiratory cases. So there's enormous opportunity here, there's enormous flexibility, but there's most of all depth and breadth. So that's my little spiel for the moment.
Thanks, Kate.
Yes.
So one of the things I want to highlight on the call too, for those of you that are still on the call, Kate and I, in our roles as relationship managers, should you have a subscription here with Aquifer, we have a dedicated customer success team that helps guide you through the process from your buyer journey to once you're subscribing and then onboarding, et cetera. And you have a dedicated account manager who would likely be one of us or someone else on the team to answer questions throughout your subscription year. One of the questions that's come up in the Q&A, Kate, if you could go to the courses page, please.
Sure.
So should you purchase, we go over demo calls if you need to have some to help answer questions. But when you have your subscription, you would have a designated administrator who can then add other administrators and faculty to your account and then add users. The question was about adding and managing users. Just wanted to highlight right at the top in green on the courses page is the dive in making the most of Aquifer.
Oh.
That's a self-directed orientation for faculty and staff. And once you're added, all users must be added, but once you're added, Whether you're a faculty or staff or a student, you will be prompted to take part in self-directed orientation. We also recommend that you familiarize yourself with it, but there are different chapters of the orientation to guide you through the system. We also offer webinars and personalized Zoom calls with the dedicated account manager to help answer all of those questions for whatever you need. Those orientations give you all the how-to guides, videos, images to walk you through step by step. So wanted to make sure that you're aware of that. And then Kate, if you can also click on the users page. So when you were saying, how do we manage our users? We do have instructions of adding and removing, but you, depending on your user role, you may have access to manage adding and removing users. You'll see this is the admin page. There's also a student page, but if you scroll down, you can see and you can sort who's registered by when. You can manage adding, removing them as you see fit. So thank you for sharing that. And thank you for that really great question. Kate, do you have any other thoughts regarding adding and removing users before we go on to the next question?
No, except actually I do, and it's a very common question, and that is, folks ask, how much does it cost to have faculty and staff in the system? And there is no cost associated with having faculty and staff in the system. Our subscription pricing is based on your total program enrollment. That is your number of degree candidates in your program, but your faculty and staff are unlimited. And we actually have a wonderful role. If I go back to the users panel for a second, the teacher role is an outstanding advantage of the Aqueduct system in that it is perfect for your preceptors. So they would have unlimited access to all the cases, the tools, the resources, and everything, but they cannot see the reporting. So it's really excellent for your kind of dispersed teaching where you're possibly more concerned now than you were even 2 years ago about FERPA compliance.
Thank you. There's a question in the chat regarding women's health. So could you go back to the content library and sort that? So depending on what you purchase, you have a number of courses you're open to purchasing. You would have access to the content library to then sort. And we do have a section here that can help with utilizing a feature we call custom courses. You can just look at the content library for content. But if, let's say, you wanted to build a custom course for women's health, you could use those sort ranges and then start adding them into a custom course and assign to appropriate students. But Kate, would you like to share additional information on that?
I would, because I would like actually to give props to one of our outstanding members of our PA task force, Kathy Erlander, who from DeSales University, who a number of years ago kindly shared with us her model women's health program set of courses and cases, and we regularly share that with programs of all sorts as a model of how to take advantage of all the cases. And it's not just a theoretical model of a women's health course. It is actually used by Kathy's program. And hands down, whenever I share it with programs, they're very impressed. It comes from real world experience, and it's not simply, kind of a theoretical filter within Aquifer's content library.
Yeah, Kathy Earhart did a really great job putting that together. There were some questions when some of you signed up. There were some questions that we want to cover now to make sure, and some of it's tied to what was just discussed. So we do have, Kate, if it's possible to go on the website, I don't know if you can.
Sure.
So we do have dedicated resources and tools created for you and by your peers. We were alluding to it earlier in the presentation, but if you can go under network. So under network, we separate it by types of programs. So if you happen to be, for example, a PA program, you have a page where on the bottom of that page, it shares additional resources that are curated for you. Now, those are also recommended throughout Aqueduct as well, but just wanted to highlight when we're, highlighting Kathy's work, some of that work is posted here on this page for you. So we do take time to gather and curate resources for you. So like listed right here, here's the top strategies from PA educators for you. So you do have a community where they've created webinars, blogs, and podcasts on common topics to help you not have to reinvent the wheel. We also offer peer consultation. So if you'd like to talk with a peer, we can certainly arrange for that too. So, and those peers are actually looking at what's a hot topic, what are the key issues that our peers need addressed, and how can we help by creating a resource. So that's also part that comes with the subscription, these resources to help you. So there was one question where people were saying, I'm a new PA program, how do I use this? So this would be a great page to review. We also, like some of the top one right there says meeting ARC PA standards with Aquifer. That would be a great resource to take a look at, especially if you're wanting to make sure that when you're choosing a resource like Aquifer, it's hitting your needs. The PA task force has also just created an additional tool that maps key standards that we can help have you take a look at too, as you're deciding. And then should you purchase Aquifer, that's part of the conversations we have as you're making your decisions of what to purchase, how to use. Peer consultations are available too, to help you really decide what's best for you and your program. Some programs start with one course and build from there. Some become curricular partners because they know they want to use all of it and there's a benefit. And we help consult in that process. So for those of you who are interested in that, because another question that was also listed was, what's the pricing? Because pricing is based on separately accredited programs, different dates, different course interests, different enrollment, you would need to have a conversation with most likely either myself or Kate. And so what I'm going to put in the chat is the link to our subscribe page. And on that subscribe page, there is a button for request a quote. And that is something that we can then take you to the next step and answer any questions you have regarding pricing to get you those answers. Other questions? We can wait just a couple more minutes. We are going on the top of the hour almost. I mean, we have 8 more minutes left, but I want to make sure that we're available to answer any questions. I don't see anything just yet.
Leah, if I may, while we're here for just another couple seconds, because I do want to allow people who've taken the time to be with us here today to think if there's anything that maybe wasn't clear or they wonder about, to point out something that was referenced, I believe by Cindy, or maybe Sherilyn at the end of her talk, is that, and Leah referenced the network section here where you learn an awful lot about programs that we work with and how we have tools and resources specifically for those programs. We also have enormous resources on the website, and you can go to, for instance, educator to educator resources. And we're constantly updating and refining these non-firewalled resources. So these are not within Aqueduct. You don't have to just subscribe to even look at these. So there's hot topics, including didactics and discussion, assessment. Obviously, the student perspective is very, very important because education has changed dramatically over the last 3 years. Strategies and tips. Again, Aquifer is associated a lot with clinical learning, but we have incredible strength within the cases for remediation. And I think it's a great hidden aspect of Aquifer, that it really can help students who are struggling. And the custom course feature allows your student to be assigned cases, and no one needs to know. The invitation and the management of those cases is directly for the student and their supervisor. But there's a lot of tools and resources here, a lot to explore. And again, none of it is firewalled. It's publicly available on our website.
And thank you, Kate. And we do have, as we mentioned earlier in the presentation, we have a lot new that's coming, starting our next subscription year. Our subscription years run from July 1st to June 30th, but that doesn't mean you have to wait until July 1st. If you want to start, January, we can do prorated mid-year starts. That's not a problem. And Kate and I can help navigate and through that process with you. And so, we have many wonderful existing and new content and tools that are being created now. Our neurology cases are coming July 1st. We have our Calibrate formative assessment, integrated illness scripts. We're doubling them essentially in the new year. So there's a lot that we are creating that are making available for you. And so if you're interested or have questions, even if you're not sure when you'd like to start, we are happy to have a personalized conversation with you, give you trial access so you can see like what Kate and Dr. Smith were showing you in the Aqueduct system. We can give trial access so you can take a look at that content library, ask deeper level questions, and really just help you make the informed decision for you. Anything lasting comments, Kate?
No, just thank you all for being here today. And I hope you had a lovely, lovely Thanksgiving.
Thank you. I agree. So thank you everyone for joining. Kate and I will stay on for the next few minutes if anyone has additional questions. And so if you do need to talk, we'll be here for the next few minutes, but here are our contact details. Our email addresses are listed here. Peer consultations are also listed. And then if you'd like to keep in touch in other ways, we have one other slide. You can connect with us and follow us on Twitter. We have lots of great information that we're posting. So thank you everyone for joining. We hope you have a good rest of your day, and we look forward to being in touch. Take care.